My name is Dr. Benjamin Abella, and I was one of the co-chairs of this year's Resuscitation Science Symposium of the American Heart Association, which of course was held virtually, unfortunately, due to COVID restrictions, but of course safety was always an important priority. I was glad to be co-chair of this meeting along with my good friend and colleague, Dr. Michael Donnino.
Hi, I'm Mike Donnino. Again, I was vice chair at a conference, and I'm an emergency and critical care physician from Boston. Was glad to be able to be vice chair of this meeting.
And so I think we're going to share with you some of the highlights for us that I think are worth thinking about if some of you are considering looking at the on-demand content, or at least just getting a flavor for what was talked about at the meeting and what we found so exciting. So I'll start off by sharing that one of the big problems in cardiac arrest clinical care over the years has been the lack of good pharmacologic strategies. So those of you who are listening, who are clinicians, you're familiar with epinephrine and lidocaine and amiodarone. Well, those drugs have all been around for a very long time, and they're just not all that successful, quite frankly. And so there's been a lack of new development in pharmacology to think about during cardiac arrest. And this year, I think for the first time, we saw a number of very innovative, interesting concepts for new approaches to treating cardiac arrest with medications, with drugs. And I just want to highlight a few of those. There was an abstract looking at management of cytokine storm. And so it is known that after cardiac arrest, patients get very sick in part from an inflammatory response, an elevation of cytokines. And there was a study looking at tocilizumab, hard to say, tocilizumab, which is an IL-6 inhibitor. IL-6 is known to markedly increase after cardiac arrest. And for the first time, we saw consideration of this drug as a treatment of post-cardiac arrest syndrome, which is very exciting. And essentially, there was an abstract where investigators from Denmark showed that they could administer the drug, and it had some benefit as well, not regarding overall outcomes, but it was sort of an early stage secondary analysis type work, but at least it showed a possibility. It showed a hint of a benefit. So I think we're going to see more on that. The other interesting abstract looked at Lysophosphatidylcholine Lpc, which is essentially a drug that could improve membrane function in the brain and other organs after cardiac arrest. And this was a really neat abstract from Dr. Nishikimi and others at Feinstein Institute in New York, where it was translational. So they did both an animal part of the study and then a human implementation part, which is exciting to see at RES, where they showed that by supplementing LPC-DHA, which is this sort of essentially a fatty acid supplement, they could show a number of effects on mitochondrial function that were beneficial. So that's exciting. And then the third abstract I'd highlight is a work from Brian Weil and others at University of Buffalo that looked at what was actually, I'll be honest, very surprising to me, because it's really never shown its face in cardiac arrest circles before, but using a drug triiodothyronine, T3, which is an active form of thyroid hormone that again showed great promise during cardiac arrest treatment. And as thyroid hormone, it's a biologic product. It's given all the time to patients already. So this isn't such a reach, but surprising benefit. So here we have 3 studies that all suggested new and innovative approaches to the pharmacology of cardiac arrest. So that got me excited anyway. So Mike, what were some of the things that you thought were really neat from this year's arrest?
Yeah, it's great. I mean, I think, we had, 5 real exciting plenary sessions that I encourage people to check out. And, it included targeted temperature management. We had one on intra-arrest management. We had a tremendous session on survivorship. The 4th session we had as a year in review, really great year in review. And also into that session, in that session, we had an update on ILCOR. So it was another exciting session. And last but not least, we had a session on special circumstances where we got to see some interesting perspective and discussion about different special circumstances, including maternal cardiac arrest and whatnot. I think, we opened up with a real exciting plenary on target temperature management. We were grateful to have Dr. Nielsen, who was the senior author on the targeted temperature management 2 trial, open by presenting their data. And then it was great that we actually had the opportunity to have two differing point of views in some ways of interpreting where to go from here. We heard from Dr. Johnson, Dr. Nick Johnson, on some what he described as real world data, and suggesting should we maybe we shouldn't necessarily abandon 33 degrees just yet. And we heard a different perspective from Dr. Nolan, who not only gave his shared some of the background, but he also shared with us the new recommendations out from ILCOR. So if you haven't had a chance to look at those, it's all in this session. And certainly, last but not least, we also then, because we hear a lot about adults, we want to make sure we're also looking at the pediatric population. So we had a great lecture on the perspectives from the children's standpoint from Dr. Alexis Tobjan. So really a great session, and something that I would definitely check out, as well as all the plenary sessions. As Dr. Abella talked about, some of these great abstracts, we had a lot of moderated poster sessions, which people can check out. We have just, the regular posters. And it's so hard, in just a few minutes here to kind of describe. I mean, really had just a really great breadth of different topics and, interesting things that we haven't really seen, some of it we haven't explored before in resuscitation science. So it's exciting to see that. One particular abstract that I thought, again, it's becoming more and more recognized at the importance of the long-term follow-up, and things that we haven't necessarily considered. And I, particularly thought that there was a very interesting abstract that looked at mindfulness in relationship to psychological symptoms in long-term cardiac arrest survivors. And what they found was they looked to see, this is Dr. Prescuti et al., and they looked to see if someone who is mindful, as they described as non-judgmental awareness in the present moment, if that was associated with long-term psychological symptoms. And it actually was. And it was interesting that mindfulness, or this being aware of the present moment, was inversely associated with psychological symptoms in long-term cardiac arrest survivors. And that has a lot of implications for, what could we potentially be thinking about, things that we could provide patients to actually improve not just these short-term outcomes within the hospital setting, but the long-term outcomes, including quality of life, and things such as psychological symptoms. So I thought that was a particularly interesting abstract among a field of very many interesting abstracts. So overall, a lot of great material to see, I think.
Yeah, no, I think that's right, Mike. And I got to say, despite the hiccups of COVID and the virtual setting and the challenges, the spirits in the community are high. The resuscitation community is a very tightly knit, enthusiastic bunch, and you could feel that through the conference. I mean, I think the interactivity really was welcome to all. We look forward, of course, to welcoming you to hopefully what will be a live RES next year, November 5th through 7th in Chicago in the United States. So those of you overseas, we hope you can rejoin us once again for a live conference and domestically. But I think the future of resuscitation science is bright. I will be stepping down as co-chair, but Dr. Michael Donnino, my colleague here, and also Dr. Sarah Perman at the University of Colorado will be leading the charge. Very excited to see them innovate and grow this program in future. So thanks very much.
Thank you. And I should also give a shout out and a thanks to Dr. Abella for his leadership over the years at his conference and his enthusiasm, which is just infectious, and to be able to carry the resuscitation science community through the past couple of years where we've had to be virtual and actually kind of put on a conference like this with the quality of the material and the interaction to the degree that we could was really phenomenal. And we, I just want to kind of thank Dr. Abella for all of his service.
Thank you for that. Well, guys, thanks for listening, and we hope to see you next year.
All right. Thank you.